My name is Sigi Marmostein. I'm the CEO and founder of Babyliveadvice. There we go. I'm also a nurse and a nurse practitioner with many years of clinical experience, and Babyliveadvice is a true passion project for me in my third part of my career. Babyliveadvice is an integrated telehealth solution that is meant to support women and their infants from preconception to early childhood. By that, prevent the terrible outcomes that we are seeing in maternal health in the United States. One of the most shocking things that people will find out is that what we call maternal mortality rate has hit 6-decade high last year. That means that women are dying in a rapid stage here in the US, which is a rich country. So the US just became the deadliest place by which to have a child. Give you a little bit of some information. MMR, or maternal mortality rate, is a true indication of public health and country's health and the access to healthcare in one's country. The most developed country or the richest country should have the lowest MMR. If you don't mind, let me read you a little bit of information from the CDC of this year. Texas MMR is in par with that of Syria. Indiana MMR is comparable to that of El Salvador. Louisiana is as bad as Kazakhstan. For Black women in Louisiana, the chances of dying in pregnancy-related causes are the same as that of Libya. Ohio maternal-infant mortality rate is at par with Pakistan. That's where we're at. This kind of media is daily, weekly, and monthly, unfortunately. We're seeing the stories of women behind the statistics, and they tell the story of a country, of a health system that is failing mothers, their babies, and women in general. Well, why is this happening? Truly, there is multi-reasons for it, but I want to speak about those that we at Babyliveadvice are trying to solve. The first is the largest payer of women's health in the country is Medicaid. Unfortunately, under Medicaid, reimbursement rates are quite low. That means that less providers and practitioners are willing to accept Medicaid as a form of payment for maternity, reducing the overall access to care. That also results in less care in the first trimester of pregnancy, unfortunately. For women who are suffering from chronic disease and mental health issues, the first trimester care is absolutely viable in order to have a safe and healthy pregnancy. We also see in pregnant women later in their maternity journey, and with that as well, we see in growing maternity deserts, social determinants of health, the inability to access care or access care equitably is another real issue of why we are seeing this ever-growing problem. No, not moving forward. There we go. Well, Babyliveadvice really is an as easy to access solution. As the speaker here said before, we are actually an app and a web RTC that can be accessed anywhere in the US and anywhere in the world. Simply print babyliveadvice.com and you can be in front of a nurse, a doula, a nurse practitioner, a mental health provider, a nutritionist, a diabetic educator, in any form, in any language, 250 language spoken, including the sign language. We are here to support the providers who are caring for those parents, the hospital delivering the care from preconception to 1 year of age. When we did that, we reduced cost of care by $14 million, improved total outcomes, I'll show you the data soon, and ultimately reduced the risk of pregnancy on the providers who are caring for those parents. We also recently launched a telemonitor and AI-based solution that supports us, not the providers, in caring for parents in hypertension, diabetes, and babies post-NICU graduates. For some reason, this does not click. Oh, here we go. Babyliveadvice is really here to close the care gap, and we're looking at maternity as one episode, preconception to 1 year of age. In the past, we were treating pregnancy as multiple episodes of care, and Babyliveadvice is a single episode of care. Parents get Babyliveadvice and the first appointment with their maternal health provider. They are told, go to Babyliveadvice and get care there. We are the one who are filling in the gaps in between providers' appointments, as soon as the parent is delivered and as soon as baby is released from the NICU, and will stay with the parent and the baby until the baby is safe and healthy, sometime up to 1 year postpartum. It is not sleeping. Sorry, thank you. There are multiple services that we provide, and they are all listed in here. As I said, all of our services are provided in the perinatal era as well throughout the pregnancy, and then all through the postpartum era. We do a lot of work individually, one-on-one, through chat, phone, and video visits in 250 languages. But we also do a lot of group classes and group consultation, which are being used very well to prevent terrible outcome and educate and empower women to do the right thing throughout their pregnancy. Here are some of our user data from this year alone. We had 62,000 unique users this year alone. And here are some really great data points for you to look at. Actually, 89% of our patients are from the BIPOC community, low socioeconomic status, living in what you consider to be maternity deserts. We have high satisfaction rate, but what is really satisfying for us the most is the fact that from month to month, our engagement is 78%. That means that a parent will be using Babyliveadvice for an average of 3 months to 14 months in most average of our patients. We also seen 88% of our parents come into our group consultation classes and loving them every single time. On the clinical side, Babyliveadvice has shown in 3 very large clinical studies to reduce C-section rates, as well as complications in general on the postpartum and the perinatal era. We also have reduced the incidence of NICU, preterm birth, stillbirth in our population, which are very high-risk populations to begin with. We have helped hospitals to maintain a baby-friendly designation and maintain initiation of breastfeeding and maintain breastfeeding postpartum as well. When it comes to health equity, there is nothing like Babyliveadvice in the market right now. Our providers are from 72 different cultural background, speaking 250 languages. These are pictures of real patients who've been served by Babyliveadvice. Yes, we did have 3 transgender births this year. They were willing to share the pictures with you. As you can see, we are serving populations who are homeless, deaf parents. We are serving populations who are very remote and rural. A lot of immigrants who are coming to this country to have their babies, and many, many different and other very unique populations, such as Alaskan or Basquian and some of the Navajo Nation. In respect of traction, Babyliveadvice investors are the OB Hospitalist Group, Care First, and LifeBridge Health. We have insurers, providers, as well as the hospital in our board, which is really helping us to shape and continue shaping our strategy as we're moving forward in this wonderful era. We are really working very much on data and data analysis, making sure that our data is going to be used to make good in the future in maternal health and infant health here in this country. We're working with very large health organizations, federally qualified health centers and insurers, and we add in 1,500 new users month to month to our platform.